Hello, I'm Kourtnee Seymour. I'm a licensed professional clinical counselor and supervisor at the Child and Family Stone Street location at 7 counties. Today, I will be talking with Dr. Patel, who is a psychiatrist and associate chief medical officer at the Child and Family Division at 7 counties. Today, we wanted to discuss how parents and guardians can support their children that may be feeling scared or anxious about COVID and returning to school and getting back in public situations and are involved in activities with others. Dr. Patel, it's been a rough year, and as recently, Jefferson County Board of Education voted to reopen schools with students. Elementary school students have already returned as of March 17th, and high school and middle school students are due to return April 5th. Dr. Patel, how can parents talk with their young ones about the return to in-person school and other public situations?
Well, and as related to COVID, I think most of the concerns for the children are about the unknown. They will definitely ask questions, and the parents should try to provide age-appropriate answers. I think one of the traps that parents fall into is they think that the kids are going to have the same concerns that the adults do. And it's generally not the same. And so don't over-explain. I think using reassurance that the adults are looking out for them and that the school is taking proper safety precautions would help children as well. I think that if parents feel comfortable, they can review the basics of mask wearing, social distancing, and washing hands. And all those things should help kids feel more secure about returning to school.
Can you take time and speak on what actually is anxiety and what would that look like for young people right now?
So, anxiety is what people would commonly call being scared, fears, worries, nervousness. And worry and fear can be a natural part of childhood development. However, it may get to a point where what we would call a disorder in children, and it's common in children to have an anxiety disorder that reaches a clinical level. Um, and when it reaches a clinical level, we define that as a persistent and excessive concern, worry, or fear that affects daily life functioning significantly. And so, for example, that would be something like a child afraid to go to school and refusing to go to school. That obviously would affect their daily life very significantly, and that's something that we would want them to seek treatment for.
And you just spoke on, you said going into the school. So can you speak on a little bit on how exposure therapy works for some of that social anxiety?
So, exposure therapy can be very effective for anxiety and social anxiety. But there's two things that are key for that. One is that the exposure to the thing that makes the child anxious should be gradual. In other words, we can't just thrust them into it. And sometimes it's just talking about it, talking through it, even orienting to them to how school is going to be. The other piece of that is the kids learning to relax themselves if they do get anxious, just doing deep breathing or maybe distracting themselves can sometimes help them. If parents don't feel comfortable with that or they don't think that that's helping, they can certainly seek a professional's help.
And can you take some time to also speak to what is the difference between internal and external motivation?
So with internal motivation, that's a drive that comes from within a person. They don't need an external force such as a reward or consequence to encourage a particular action or behavior. On the flip side of that is external motivation, where an outside force encourages a particular action or behavior. And the most common kinds of these are rewards and consequences for children. And, it's very common, give them a treat if they do something that you like, or, oh, if you don't do this, you're going to get a consequence like a timeout. Those are pretty common external motivators. One of the things that happens is parents really want to know if external motivation will lead to internal motivation eventually with their children. And so what I tell them is this, and that is that there are certain types that can lead to that. And one of the ones that is probably best for this is what is termed positive praise. And so in other words, it's pretty self-explanatory. You're really using your words as the caregiver to encourage your child. In other words, congratulate them for a great thing that they did, or they did something really kind. You're really kind of going over the top and praising them for it. And this will work because if you do it repeatedly, it can change an internal motivation, because the more times the child hears these positive comments or remarks about themselves, the more they believe in their own competence and self-control. And then they eventually begin to believe these things. And that leads to them internalizing these values. And then that leads to an internal motivation.
And when would you say is a good point for parents to seek additional help when they try to do those things and things just don't get better? But when should they try to seek therapy for their child?
Well, if a family has, they see an anxious child, and, the caregivers, the guardian, the parents, the family supports, whoever it might be, has tried some of these things that we've talked about, or tried reassurance, really tried to help talk to the kid about things to try to reassure them, and they're still having anxiety that is persistent and excessive, and they don't see it improving, and the family feels like they have exhausted what they can do, then I think that's the point where you say, you need to call a professional and seek help. And that's exactly what 7 counties can do for them. They certainly have, we at 7 counties have a breadth of experience with anxiety, and have many ways to help these families.
All right. Well, thank you, Dr. Patel, for your time. And if you or your child are in need of services, please give 7 counties a call at 502-589-1100 to set up your first appointment, or you can go to 7counties.org and request your first appointment as well. Thank you.